to know for this upcoming 2025 annual election period. Welcome back to Preferred Medicare, your go-to channel for everything Medicare related, especially this year. I'm Holly Cohen, licensed independent broker, and today we are diving into the essential guide for Medicare annual enrollment period for 2025. Whether you're already enrolled in Medicare or just curious, this guide's going to cover everything that you need to know for this upcoming 2025 annual election period, including key dates, plan changes, and how to make sure that you're getting the best coverage possible. So let's jump right in. First things first, what exactly is Medicare Open Enrollment? You might hear it called the Annual Election Period, or AEP. This is the time when anyone enrolled in Medicare can reassess their current plan and decide if they want to make any changes for the new year. It's your yearly opportunity to see if your current Medicare coverage is still the best fit or if it's time to make a change. You can change from Medicare Advantage to Original Medicare or Original Medicare to a Medicare Advantage plan, or even update your Part D prescription drug plan, which you'll see in a different video on how to do that for next year. When is Medicare Open Enrollment? So mark your calendars because Medicare Open Enrollment or Annual Enrollment Period kicks off October 15th and will run through December 7th. This is the window that you need to keep in mind if you're planning to make any changes to your coverage or if you've received any letter or notice in the mail about changes to your coverage. There are a lot of changes coming up for 2025. I do have that information in a separate video. So please listen to this video so that you are well informed on what you need to do if you've received a notice or a letter that your plan is changing for next year. What changes can you make during open enrollment, October 15th through December 7th? You can switch from Original Medicare to a Medicare Advantage plan. You can switch from a Medicare Advantage plan back to Original Medicare. You can switch from one Medicare Advantage plan to another, or if you're on Original Medicare with a standalone Medicare Part D plan, you can also make a change to that. Or you can also enroll in a Part D if you did not enroll in one when you first became eligible. So you made a change, but now you're second guessing it. No worries. You can change your plan multiple times during the annual enrollment period. The plan selected last by the December 7th deadline will be the one that will kick in on January 1st, 2025. So take your time, compare your options, and do not rush the decision. So if you need to make a change to your Part D for 2025, the best advice is to watch my video. You can do it online. You can create a Medicare.gov account for yourself. You can also give us a call. We can assist you in a plan review for 2025. And another way to contact us is if you take a photo with your smartphone on that code that you see on the screen, that will take you right to our calendar where you can book an appointment for a free 2025 Medicare plan review by either me or a very trusted member of my team. Now, who can make changes during the annual enrollment period? If you've already enrolled in Medicare, whether that's Original Medicare or a Medicare Advantage plan, you're eligible. However, Medigap plans have different rules. If you're already enrolled in Medicare Parts A and B, whether that's Original Medicare or if you're on a Medicare Advantage plan, you are eligible to make a change during this annual enrollment period. Medigap plans do have different rules. If you need to apply for a Medigap plan during this period, there could be in most states medical underwriting if you've had Part B, as in boy, of Medicare for more than 6 months and you're trying to get onto a Medigap Medigap plan. The underwriting can vary from carrier to carrier. They'll either completely approve someone or they'll completely decline someone. But if you're on a Medicare Advantage plan and you want to get back to original Medicare, October 15th through December 7th is the time. Actually, most carriers will even start taking applications for Medigap October 1st through December 7th. If you are approved by a Medigap insurance company, provided you've had Medicare Part B for more than 6 months, and you do have to go through that underwriting. If you are approved for a Medigap plan, such as a Plan G, a Plan N, or if you were born prior to 1955, you can switch from a Plan F to a different Plan F, or a Plan F to a Plan G, or a Plan F to a Plan N, or any of those different letters. Just remember that if you've had your Part B, like boy, of Medicare for more than 6 months, you will have to go through about 26 to 30 health questions and a list of your prescriptions, and the insurance carrier who is representing that Medigap plan will either approve or deny you based on those health questions. Some carriers, a very, very, very small amount, will approve some conditions, but with a higher monthly premium than the select or preferred rate of someone who's in very good health. If someone does have some serious health issue or issues, there is a huge possibility for a decline for a Medigap plan. It's not a guaranteed issue. That open enrollment window a person receives when they first go on to Medigap is only when they first start Part B for the first time. They have a 6-month window prior and 5 months after their Part B start date where there were no health questions. During this annual enrollment period, if you are to apply for a Medigap plan and you've had Medicare Part B for more than 6 months, you will have to go through the medical underwriting. One other quick note, if you are just starting Part B for the first time, but what if you had Part B quickly for even a month in the past? Let's say you're now retiring, but you're older than age 65. The Medigap insurance companies will retroact and they will go back to that first start date. So that means that you would have to also go through underwriting questions. Again, if you have any questions, because there is so much to know about Medicare, if you have any questions, always feel free to contact us. You can call us at 855-265-6334. You can take a photo of that QR code and schedule an appointment with either me or a member of my team. We would love to be able to help you clear any information up, or just drop a line in the comments and we'll be able to answer whatever's on your mind. Until next time, and as always, please be well.